We are going to go over place of service codes today. So place of service is, of course, part of your CMS 1500 claim form, and we're going to go with place of services dealing with all of the CMS 1500, not the UB 04, which is all inpatient facilities. So we're going to deal with our outpatient types of services that we bill on this form. So of course, where is the place of service form? So when dealing with the CMS 1500 in box 24B, you'll have your place of service. And all of these 2-digit codes are going to come from our CPT book is one place you can find them, Medicare website, all sorts of places will have the CMS 1500 place of service codes for you to use. But remember that place of service code, we're indicating to the insurance carrier, whether it's Medicare or Blue Cross or any carrier, where that place of service is taking place. So it also needs to correspond with box 32 of our form. So that service facility location information. So because your facility or the location could actually be different from box 33, which is your billing provider information. So you want to make sure that your place of service is corresponding with where that service actually took place. So starting to go down some of these place of services codes, there are many of them, but they're all broken down for particular reasons because they're all different places, all different types of services can take place in a matter of different locations. So we want to make sure that providers are getting paid their adequate fees that they're supposed to be paid for the type of facility that they are in. Remember, there's a lot of overhead that go into some of these codes, so they need to look at where that place of service is to put that into their conversion factor for how the reimbursement is going to take place. So these are pretty important. So 01, we have a pharmacy. So this could be a pharmacy, whether it's a standalone pharmacy or your hospital pharmacy. So you want to make sure this is where all of the services are taking place. You'll see this come into play in some of the other ones that could have multiple areas or multiple distinctions for what do we count that place of service as. Number 2, 02 is telehealth. Of course, this is fairly new. So telehealth is a new code, and I did provide 2 links at the bottom here that do help with information about the telehealth codes and using the proper place of service. So they're both from cms.gov and just information about telehealth itself and then dealing with the codes, because this is where the health services are provided or received. So the provider's the one billing. So you want to know where the provider was when the services were granted. So in using any kind of telecommunication system. So there are particular guidelines, though, that come with telehealth services. So based off of CMS, so based off of Medicare, in billing a charge to Medicare for telehealth, it has to meet the criteria, and it has to be a county outside of what they call the metropolitan statistical area. So of course, you're not doing a telehealth service on a Medicare patient in the middle of New York City unless it meets a certain criteria, or it's a rural health professional staging area. So in a rural area, they might have set up a location where telehealth services can be received. And this could be all different types of providers can do telehealth services as well. So if you have a provider who wants to start billing telehealth services, then definitely look at some of those Medicare guideline links there to give some additional information on properly billing these telehealth services. 03 is school. Probably don't really see this one very often. And for school is defined as for the primary purpose of education. So you can think of course, your school nurse. Well, school nurse doesn't really bill your health insurance, maybe, Maybe it depends on your state guidelines that they can allow it. I've never seen a bill go through my insurance carrier for any of my children seeing the school nurse, but it depends probably on your state guidelines of what that nurse can actually even provide. But then you think, well, my kids go to college, and that college facility has a healthcare services clinic. Does that fall under school? There's other criteria that could fall in there as well. There's actually nothing I've seen that I've been able to find strictly saying these are the type of services you can bill for in a place of service 3. I couldn't find any information anywhere. So CPT usually suggests as long as there's another place of service that more adequately describes that information. So if you think of a college healthcare clinic, it could be structured as an urgent care type where they're there 24 hours a day and staffed. Probably not. But whether they're staffed, whether they have appointments, whether they fall under one of the other clinic types of place of services prior to being used as school. Now, something else that CMS mentions a lot in their claims billing manual is that some of these place of services could be crosswalked, indicating another type of service. So they give a timeline of when these were crosswalked for. And also that per HIPAA, they have to accept some of the claims, but they could wind up denying them requesting the correct place of service. We have 04 as a homeless shelter. So this is providing temporary housing for homeless, because you also see some other place of services that indicate temporary housing. So we want to make sure that we're indicating specifically that this is a homeless shelter. This is a place that provides temporary housing for homeless individuals, and we provided some type of medical service at that type of facility. So there was one guideline suggested from Medicare that if you provide a DME, they count that as a home service, which would be a 12. So the shelter for a DME supply service for a Medicare patient, you're not going to use 04, you're going to use a 12. So if that's something you do, you might want to make sure that you've got these guidelines correct from CMS. There are some additional criteria for homeless shelter. So just pull up their site. If you perhaps have a provider who goes around to your local homeless shelters to provide care, make sure that you're indicating the correct place of service for the care that's being provided. When we get into the Indian Health Services, 05 is your freestanding facility. Now, this is something that's owned and operated by Indian Health Services, providing care to the American Indians and Alaska Natives, but care that's not requiring hospitalization. So that's a different code. So this is just a freestanding facility, outpatient type of facility, giving care to these individuals operated by the Indian Health Systems. So you'll see Medicare doesn't actually use these place of service codes. They are going to accept the claims, but there's additional criteria that is required for people who bill in these types of facilities. And if this is something that you work on one of these Native organizations providing care, you should already know these. But if this is something that you're moving to an area and that's a field that you might get a job in that office, you might want to investigate a little bit more some of the criteria required for Indian Health Services. They will accept your claim, but then they're going to send it back as unprocessable because it doesn't have the adequate place of service required for Medicare to accept that claim. And then Indian Health Services, a provider-based facility. This is your inpatient or outpatient. And again, they don't use Medicare, does not use this place of service code. So again, you want to make sure you've got your criteria. The same thing with the tribal 638. So Medicare doesn't use this place of service. They'll return your claim as unprocessable if you indicate a 7 or an 8 on your CMS 1500 form for the services you provide to a tribal 638 patient. Number 9 is your prison and your correction facility. So these are services, of course, provided in an institution. Again, Medicare has guidelines for these claims because there are certain instances where you can bill them. Technically, under Medicare, Medicare is not going to pay for anybody in a penal facility, and they indicate that in this Chapter 1, Section 10.4 is the ruling about that. They're not going to pay for those services, but that's Medicare. So you may have other services. I know we ran into this a lot. I work in an orthopedic office, and we have a local jail near us. Orthopedics, you break bones, you get people who maybe were in a fight or something like that. They brought them in for treatment. It falls under kind of a technicality that you're actually filing that claim to the jail themselves. So you're not filing it under the patient's health insurance, because usually depends on the carrier. While that patient is incarcerated, then they are not covered under their insurance plan, which is the same with Medicare. If they're incarcerated, they're not covered under Medicare. So, but if they still have a plan that allows medical coverage, then the prison or the correctional facility usually tells you that and asks you to submit the claim to that insurance carrier. It doesn't happen very often, but usually the prison or the correction facility themselves is going to pay that bill. Of course, 11 is office, which pretty much is any physician office setting. So I didn't really go into too much detail about place of service 11. It is one of the most widely used place of services on the CMS 1500 claim form. 12 is a home care, and this is patients who are receiving care in their private residence. Now, there are some other criteria that people will say that they're in their home, and we'll go into some of these other place of services that may seem similar to home care that's being provided in a private residence. 13 is your assisted living facility. So this is where people have their own little apartments. So they're self-contained living units. So maybe your grandparents or aunt and uncle or somebody lives in an assisted living facility. There's on-site support, but they live in an apartment. They have a kitchen, they have a dining room, a bedroom, living room. They invite friends over. They might perhaps have activities, put together at these types of facilities, but each person is kind of independently living in their own apartment, but they have support available 24/7. So they can deliver this types of services, or they can arrange for other healthcare services that might need to be provided. A group home is where you're sharing those living areas. So it's possibly 2 or 3 people sharing rooms in a house considered as a group home, because they have supervision there of the clients living in this home. They only offer minimal services, and that's usually behavioral or social services that are usually offered in a group home. Depends on the patient, of course. A mobile unit. So this is not an ambulance. So people don't want to get some confusion here. If another place of service exists, you're going to use that. If the mobile unit from the local hospital came to the shopping mall and provided services, or outside of the library maybe, or something like that, they help people in the community in a location. So that's a mobile unit. But if the mobile unit's outside of the hospital, outside of a physician's office, you're going to go with that place of service that exists there. If it's the physician inside this office goes out to the mobile unit outside in his parking lot and is helping people there, That's an extension of his office that he can bill under. So place of service 11. So, you know, you see sometimes they had those while they're building new facilities in a hospital, they might have a mobile unit there because they're under construction. So that's going to be counted as the hospital outpatient type of setting, not a 15 mobile unit. So you want to think standalone mobile unit. 16 is temporary lodging. So remember I said there's different kinds of houses, different kinds of categories. So this is your short-term living, temporary lodging. And the examples that they give are cruise lines, hotels, a hostel, a youth hostel. So you think of a cruise, you've got a clinic on board a cruise or some kind of doctor office type of thing on a cruise. This is going to be your place of service 16 for temporary lodging. So this is just short-term living, short-term. You might have be stationed at some kind, or you know, go to some kind of resort area. Well, they might offer a clinical office in the resort for people who sprain their ankle or get sick or something like that. So just very short-term temporary lodging. Up and coming, of course, we're going to see them all over the place, is the walk-in retail health clinics. So, of course, you know, CVS, Walgreens, Giant, a lot of the drugstores or major grocery stores are now going to have these health clinics. Oh, just come on in and be seen. Walk-in retail health clinics. So they're affiliated with a retail area. So these are not an urgent care, and this isn't considered pharmacy, because it's a clinic established in the building or whatever structure that is not pharmaceutical services. These are your come in, you think you have a cold, let's check you out kind of services. Walk in. And if it's dealing with immunizations, because you'll see that all the time, you'll drive by in October and November at your local grocery store, any pharmacy, come in here and get your flu shot and get $10 off your services. So those immunizations that are being provided in these types of facilities fall under a separate guideline. So if you're going to be affiliated now, or you work for a billing organization and somebody wants to, you know, all the CVSs in your area want to now contract with your billing organization to send out all these services. There are specific guidelines for Medicare for these types of services, because remember, immunizations require a certain ICD-10 code, require a certain CPT code, require certain criteria for Medicare in order to pay that claim. So there's specific requirements when you're dealing with immunizations of these walk-in health clinics. 18, a place of employment or a work site. Who has one of these? Well, we all do, because we all work in doctor's offices. But you would see these, you know, think of Google or Amazon or some other large companies may have on their place of employment, or they may have some type of clinic or facility available. You know, you feel like you're starting to get the flu. Of course, we don't want to get the rest of our people sick. So why don't you come in and be seen? It's only for the employers. So it's a private entity where that patient's employed is offering services there at that entity. So that, or a health professional can go on site. You think of ongoing rehabilitation. So actually, this is one code requested by the APTA, the American Physical Therapy Association, because they do a lot of things like job evaluations. They want to see what you do in your day. They want to see where your desk is and the type of chair you have, and do you need to be raised or lowered, or do you need to have special equipment available that's going to help your care. So they need a place of service in order to bill for those services that they just provided. So 18, they've gone to your place of employment. So whether your place of employment offers some type of clinic or a doctor available, or they have a provider coming to your place of employment to do some kind of evaluation. When we get into the hospital, this gets a little bit more confusing. And if you do get confused by this, CMS does have a lot of information out there, and pretty much every organization that you may belong to, whether it's a cardiology association or something like that, they are going to have something on their website as well. So I found a lot of information about these place of services because it does get very confusing. And you'll see as we go along. So 19 is off-campus outpatient hospital. So these are services you're giving outpatient hospital. They don't require any kind of hospitalization on the part of the patient. But what is a campus? So a campus is the physical area immediately adjacent to that main building or to other areas or structures, but are located within 250 yards of the main building and any other area determined by CMS to be counted as a campus. So you may think, you know, Johns Hopkins may have this large area taken up Baltimore of you know, all sorts of medical offices. Well, that whole thing is considered a campus. So they're all within 250 yards. Anything within that area is going to be considered your outpatient off-campus hospitalization. You're dealing with your off-campus or on-campus. So Johns Hopkins, they're all on campus. You got this other facility over here, it's off campus. It's 2 miles down the road. It's not affiliated with them directly. It's not right contingent in their area. On campus outpatient hospitals, 22. So the same thing, you have off campus and on campus. So I put these two together so that we can look at the differences here, because there are codes that come in between 19 and 22. But it has a minimum requirement unless you know the location. So a minimum requirement means you can put in a 22 for on-campus outpatient hospital for the services that you have. That's the minimum requirement. Unless that provider knows the location, such as it's an emergency room or ambulatory surgical center, or there's other criteria listed on the CMS site regarding this, but you can put in 22 unless that provider knows there's a more specific location. And you'll see this as well with inpatient as well. They'll do this too. But if there's something else I could better describe it that the provider knows about, that's what they're going to use, or they could use the 22. So some of these get tricky. Do I use an 11? Do I use a 19? Do I use a 21? What are we dealing with? A physician can have an office on that hospital campus. So that would be an 11. When those services are performed in a separately maintained office space. So it's still on the office, still on the hospital campus, but it's separately maintained. We do our own stuff over here, and it's not considered a department of the hospital. So they can bill a place of service 11 on hospital campus if it's separately maintained and you're not considered part of the hospital. So anybody in these facilities that happen to have it, they are going to know that they are not part of the hospital. We are our own office, and we do bill under a place of service 11. It could get confusing for a patient, but I think in insurance in general, it's confusing for a patient. So the people dealing in this type of office structure, they're going to know that they are a place of service 11. But just be aware that there is office type services for physicians who are on a hospital campus. So you also can't, the physician can't self-refer. So if they're using the place of service 11 because they're on the campus and they're separately identifiable, they have their own separate location, they can't self-refer back and forth. So it gets into some of those healthcare laws that we deal with all the time. So there's no self-referral in a case like that. So urgent care facility, of course, we got these all over the place. You know, the hospital's here and 20 miles away, they have an urgent care facility. So of course, what counts as an urgent care facility? These are unscheduled. You don't call the urgent care and say, can I be seen at 5 o'clock or 7 o'clock? I know you're open late, you're operating at hours after a normal physician's office hours. You don't make an appointment. These are unscheduled walk-ins looking for immediate attention, and they're distinct from that emergency room. They're separate from some office. So the doctor may run an office during the day, and then the office space next to them in the evening is an urgent care. It's distinct from that office. It's separate from any other clinic or ER in the area. So sometimes you see an ER, you walk in the room of the ER, or you could be seen at the ER, they might triage you over to their urgent care facility. So they have to be separate from the ER. Inpatient hospital, again, this is where we talk about reporting the minimum. So if we know that patient is registered inpatient, they're going to be a 21. They're inpatient in the hospital, place of service 21 for those physician services that are billed on a CMS 1500 form. So what is that? So our orthopedics, we're called over to see a patient. They came in through the ER, they've had all sorts of problems, they're admitted. Well, when they had a heart attack, they fell and they hurt themselves. So our physician is going to go over to the hospital. They're inpatient, they're going to be there for a couple of days because of their heart problems, but they need to be treated for that orthopedic problem. So we will go over to the hospital. They are inpatient, but we need to submit our services to Medicare Part B, because we don't fall under the hospital's Part A. We are a separate physician providing our services. So we're going to report a 21 unless we know that that patient has another type of service. We know that they were in the psychiatric inpatient hospital, which is on the 3rd floor instead of the 2nd floor. So we know people on the 3rd floor are considered psychiatric inpatient. So if we know a specific type of inpatient they are, whether it's skilled or comprehensive or psychiatric, we would use that specific place of code, but the minimum at least, we know they're inpatient, we know they're at the hospital, they're inpatient, we'll bill a 21. And these are where the patient actually receives those face-to-face services. So that's what counts as to where that place of service is going to be. Where is that face-to-face service taking place? Of course, 23 is your emergency room of a hospital, and they did add that, that's hospital. 24, you see a lot of nowadays, is our ambulatory surgical centers, or ASCs. So you may hear them all the time referred to as an ASC. That's an ambulatory surgical center. So that typically you have a procedure being performed on the patient, whether it's just some kind of a kid's ear tubes being put in, or a minor procedure being performed at an ASC. You can have an ASC and physician treat the patient with a place of service 11. There are certain criteria again. The office services are separate from those surgical services that we're performing. So while the patient's there having surgery, they can't say, "Doc, I have a cold. Can you see me for it and give me some medicines?" The two can't be together. They have to be separate. The ASC can't be open at the same time as the doctor's office. So they have to have separate hours in order to be seen. Now, I had this... the OBGYN I used to see was up, 40 miles away. So they used satellite offices a couple days a week. Well, one of them they used was in the evening. That's an urgent care type of facility, or, they had other things going on in those offices. at different hours of the day or different times of the day. But on the days that our doctor was there, it was considered an office because they weren't running anything else. They weren't running the ASC during that time. So it was an office. So they're considered an office space. And there actually is a criteria for a distinct entity. Now, if anybody's ever dealt with ASCs, you know that there's a booklet of information that you have to do in order to be established as an ASC. You've got all these walkthroughs and appointments and meetings and everything that's got to be done. So it's a whole list to open up an ASC. So it's a distinct entity. So that is, you can use a common space. So your ASC is over here, your office is over here. You can use a common space. The waiting room can be the same, but you can't be treating patients in both the office and the ASC using that same waiting room. So it's a distinct entity. In the evening, it's this, or on Mondays, Wednesdays, and Fridays, it's an ASC. On Tuesday and Thursday, we use it as an office. And you have to keep separate medical records are required as well. And the separate medical records must be locked up when the other facility is not in use. So there are a lot of criteria listed out there. 25 is your birthing centers. So we see these much more common nowadays. It's not a hospital, it's a birthing center. So they have rooms in there in order for you to deliver the baby. They have doctors able to provide care to the baby and the mother. So these are not part of the hospital's maternity facility, not part of the hospital's maternity ward. These are separate facilities that just operate birthing babies. Military treatment facilities, of course, these are owned by the uniformed services. So I wrote down a couple examples so you could understand what we're talking about here. In Washington, D.C., we have Walter Reed, a very large facility operated for the Army. There's Kessler Medical Center in Alabama, Beaumont Army Medical Center. You even have our foreign medical centers. So Lundstal Regional Medical Center in Germany is considered a military treatment facility. So these are facilities designed specifically for treatment of military areas. The skilled nursing facility. These get a little bit tricky in here. So dealing with skilled nursing facility, a nursing facility. So what's the difference here? Skilled is a healthcare institution that has at least one full-time registered nurse as well as a doctor. They provide 24 hours of care, and they can store and dispense medication. These are typically your short-term cares, your skilled nursing, somebody who just had a hip replacement, somebody who needs this care short-term. They're a little bit better to be in the hospital. They don't require constant hospital care, but they're not ready to go home yet. So you've got that interim. So these are short term after some kind of illness or injury, that it's a facility providing them the care with the access 24 hours. Where a nursing facility has licensed, their individuals, they require a higher level of medical care. So your nursing homes, that can't be provided at the assisted living facilities. So you see how they seem alike, but it depends on the services that were offered there. So these are 24-hour attention for longer care that's being given. And then they did make a new change this year. On a regular basis, your healthcare related services above the level of custodial care. So it's not just custodial care like a group home. You're at the next level above to other individuals with intellectual disabilities. So they could be in a nursing facility. So they added those wording this year of with intellectual disabilities. Again, we have a custodial care facility, and that is offering room, board, personal assistance without that medical component. So you need help bathing, you need help, other types of help, assistance, and they're offering you're having your room and board incorporated with that care that they're providing. At the bottom there is something I included. It's a link to CMS. And it describes the difference in some of these services. What do you count as skilled? What do you count as a custodial care? So they break down the two so you can see which the difference is between them. Hospice gets tricky as well. So hospice has some criteria as well from CMS, because typically a patient indicates that they're using their hospice benefits. And that's they're on their last, the last time of their life. So they're going to use their hospice benefits for all this care that's required. So do we use the place of service 34 to indicate hospice in certain circumstances? And they're all laid out in the CMS guidelines. So an inpatient respite or a general inpatient care stay, you are going to bill that hospice 34. If the patient has elected to use that hospice benefit, they're inpatient, skilled, or a hospice inpatient facility, you're going to use the place of service 34 because they've elected their hospice benefit. Outpatient settings like an office, a home that's not operated by a hospice facility, you're going to use the place of service for that type of facility. So if it's a home, 12. If they're at home and you're providing home care, it's a 12. So like you're providing the home care in a nursing home, it's a home type of care you'd receive while they're in their hospice at a nursing home. You're still using the nursing home 32, assisted living 13, etc. These are all outlined in CMS. Hospice does get very difficult because they also name a hospice provider. So like our local medical assistants won't accept any other claims secondary to Medicare because they're not from that hospice provider. So some insurances may have different criteria when billing for hospice. So if you are a hospice provider or a hospice facility, you may want to look into a lot of those criteria that are outlined in CMS and the local carriers that you participate with, like Blue Cross and Aetna. Ambulances can be a webinar all in itself because the ambulance billing is very difficult. So you have modifiers indicating where it started, where you're going. You have your units of how many miles, what type of facility they came from, where they're going to, if they were deceased before you got there, if they deceased on the way. There's all sorts of different billing with ambulance. But our place of service of ambulance, you have two. You have land type of ambulance, and then you have air or water ambulance. And then when you deal with air, you have modifiers to indicate whether it's rotary blade, helicopter type of transport, or propeller blade, airplane type of transport. And these aren't your mobile units, remember, these aren't 15. They have certain criteria for the ambulance, what kind of care can be provided in that ambulance. It's a very, I think ambulance has its own section in the Medicare billing guideline. 49 is an independent clinic. So what counts as an independent clinic? It's not part of a hospital or any other service. So we talked about those college facilities. They could be considered 49, an independent clinic. They're not affiliated with a hospital. They kind of don't fall under another category. You know, if you've been getting denials under school, then they might count you as an independent clinic. A lot of times, too, that's how you're established with the insurance carrier as well. That's another thing you want to look at. If you're getting some kind of denial, how are you listed with that insurance carrier? So that could be something to look into, too. But it's a freestanding ER that's not affiliated with a hospital. Maybe it's dependent upon the area you're in or something. You have an emergency room that's not affiliated with a hospital, they might count you as an independent clinic. And then, of course, we have our federally qualified health centers, or a place of service 50. Those are going to be in your underserved areas. And we get into some of our psychiatry. So you have an inpatient psychiatric facility, which offers 24-hour care for inpatient mental illnesses. So that's a facility treating inpatient mental illnesses, 51, and there's care 24 hours a day. We also have a partial hospitalization. So you're part of a program that you're going to come to this facility, but you're not inpatient. You're not there full time requiring hospitalization. You're part of a program for these illnesses you're treated for. And then you have a community mental health center. So they do a lot of different things. Outpatient services for children or elderly who are chronically ill. Residents discharged from inpatient treatment, but they're kind of at that interim, so they might be at this health center. They could offer 24-hour emergency care services for these people as part of the center. You could have day treatment. You could have part of some of that partial hospitalization. They come in for their services. Screenings need to be done before they're put into a state mental facility. They can perform screenings at these community mental health centers. There's a lot of different things. You could still provide your consultation, your education services. In Iowa and Michigan, there's a very large facility called Pine Rest Christian Health Mental Services. So they deal a lot with people. They have all of these services. They offer inpatient, they offer outpatient, they offer community help. So it depends on, remember, how you are listed with that provider, with your carrier, as to what type of facility you are. So if you fall under this criteria, then you're going to bill with a 53 place of service. Of course, we do have other also dealing with the same psychiatric types of place of service codes. 54 is you're above that custodial care, but you're not quite hospital. You're not quite skilled nursing facility. You offer intermediate care for individuals with intellectual disabilities. So you're 54. Residential substance abuse treatment facilities are 55. They offer the therapy, they offer the lab tests that you need to get tested for drug or alcohol abuse, offer room and board. So these are live-in residents that don't require acute medical care. So you're part of this substance abuse facility. You've heard of these out in Arizona or other, places that offer, you go there for your 28-day care or such. And 57 is your non-residential. So all the same services, but you don't live there. So you're getting the substance abuse counseling, you're getting the drug testing still, you just don't live there. 56 is a residential treatment center, so they are offering 24-hour, it even says total 24-hour therapeutically planned living environment. So the entire encompassing everything you need to do around the psychiatric residential treatment center, and they are professionally staffed. So they have nurses there or doctors or whatever. A mass immunization center. So you think of Giant asking everybody to come in here in the month of October and get your flu shot. So these could be your public health centers, it could be at a pharmacy, it could be at the mall, it could be in your physician office. But we're thinking here mass immunization. The college asks you to come, and every student come and get your flu shot. So they're going to bill all these out. They offered all of these services in 1 week, come and get everything all done. And these are for pneumonia and influenza virus vaccines. So it's for pneumonia and flu. So you could do a mass immunization center. Remember, Medicare has specific guidelines for doing those services. So it may be better suited with a different place of service, because just like ICD-10, you want to use the most specific code available, best describing those services. 61 is a comprehensive inpatient rehab facility, and 62 is your outpatient rehab facility. So they both offer supervision of physical and occupational therapy, speech pathology services. The 61, the inpatient facility, they could also be dealing with orthotic or prosthetics or some kind of social or psychological services, perhaps PTSD. These are inpatients with physical disabilities, and 62 is your outpatients with physical disabilities being treated for whatever problem they're coming in for, physical or occupational therapy or such. 65 is your end-stage renal disease facility. This is other than a hospital. So these are not hospitals. You might see some kind of dialysis centers or, freestanding on their own. These are not hospitals, but these are also services given to the caregivers of the patients as well as the patients themselves. They could use this place of service code 65, even if they're giving training and guidance to the caregiver who's the one helping the patient at home the rest of the week or the rest of the time that they're not at the treatment facility. You have your public health clinics and your rural health clinic. So place of service 71 and 72. Your public is maintained by your local health department or your state health department. They provide primary care where you're walking in, you're walking out. That's ambulatory primary care. And your rural health clinic is a certified facility in a medically underserved area. So you think of some of your very small towns in mountainous areas in Alaska or West Virginia or something like that. It's a rural health clinic. 81 is your independent laboratory, and the very big word there, independent. So it's not part of an institution, it's not part of a hospital, it's not part of a physician's office. So you might go to LabCorp or Quest or somewhere, a freestanding facility independent of another institution or a physician office, and you're going to use an 81 there for a place of service. And of course, like all the other codes we have, we've got other. So 99, an other place of service. So if there's some kind of place of service that doesn't fall under any of those other categories, it's not a home, it's not a residence, it's not a psychiatric facility, it's not even an ambulance, it's some other service, some other place of service that you can come up with is 99. Now, how are these paid? So you have these particular places of services, so they break them down into facility payment rates and non-facility payment rates. If you ever go to look up the fee schedule of a particular CPT code, you're going to see on cms.gov or your local MAC or however you're looking it up, they're going to give you a facility rate and a non-facility rate. Which one do you fall under? Facilities are all of these listed here. Inpatient, outpatient, our ER hospitals or ambulatory surgical centers, military treatment facilities, skilled nursing for a Part A resident. So there's services that are included under Medicare Part A when you're at a skilled nursing facility. There's also services under Part B when you're at a skilled nursing facility. So facility rates when you're billing Part A, of course, because that's inpatient facility, you're going to get a facility reimbursement. Hospice for your inpatient care, because remember we said a hospice can also be performed at other places of services like 12, like a home, like an office. So anything for the inpatient care is going to be paid as a facility rate. Ambulances are considered facility, and our psychiatric are also considered facility, and our inpatient comprehensive rehab. So anything dealing with inpatient, you're usually facility type base, and the pay schedule will be different than our non-facility. So non-facility is all the other. So we've got our pharmacy, our school, our shelters, group homes, birthing centers, urgent care, which a couple of these are listed twice, I apologize. So our federally qualified health center, end-stage renal disease treatments, independent labs, these are all non-facility. Now, if you notice you're getting rates of payment that are not the same as listed on the CMS site or similar, or they come as a different way, double check and make sure how you are listed as a carrier or how you're listed with that carrier as a facility. Are you listed as a facility or a non-facility? If you're urgent care or you're 49, you're that independent clinic, make sure that when you were credentialed with the carrier and all of your information you filled out, you're listed as the proper type of carrier, because that's going to affect your payment. So what kind of facility or non-facility are you listed as? And then send in your appeals. So get that corrected or get that changed, or if the carrier made a mistake and paid you at the wrong rate, then make sure that you bring that to the attention and do the appeal to get those claims corrected and get the proper rate of payment for the services you provided in your place of service. So that's all that I had. I'll quickly see if we have any questions. I don't see any. So if you have any other questions about place of service, or if you have any other problems you're having, you can always submit in a topic request to the CCO Club. Or if you belong to the CCO Club, post one of your questions in there, and we will definitely do our best to find the information that you are needed for the concern that you have. So I hope everybody has a great rest of your day.